We have a question from Anne, which asks, some people say that they developed tinnitus when they were sick with COVID. Is that true? Yes, that is true. In fact, I have a personal story to share. I've been spending time with my family in the Northeast, and I was staying at home, and my dad got COVID. My dad was socializing, going to some bars, hanging out with some friends, and he got COVID. Well, guess who got it too? Yours truly, myself. And really, for 3 to 4 days, I had significant symptoms for me. It was probably the most sick I've ever been in my life. And my tinnitus, which is generally low level, generally I only hear in quiet places or when I'm stressed or anxious or going to sleep at night and it's quiet. My tinnitus was the loudest it's ever been in my life. I knew that I shouldn't freak out. I knew that I was going to be okay. It was not piercingly loud. And when I was listening to audio, playing music, or distracting myself with something, then my tinnitus was manageable. So personally, I can say that having COVID can spike tinnitus. Keep in mind, I, as a medical professional, had my first vaccine, Moderna vaccine, back in January, February 2021. And then early November 2021, I was due for a booster shot. I didn't have one, should have, will have that soon. And I got COVID. I was out for about 5 days. First 3 days were really rough and my tinnitus was louder. So for most people, just like me, that comes down. That doesn't stay longer than a week, right? If you have a side effect of symptoms, then you might have louder tinnitus during that period. But after that, it usually for most of these cases with COVID, the tinnitus does not linger. Now, some patients have long haul COVID. Some patients have tinnitus that lingers, and getting sick may have been one of the big factors for why that happens, right? There might also be other factors at play: somatic tinnitus, chronic stress or anxiety, insomnia, hearing loss. So there's other factors too. So, yes, and that can happen. And thank you for your question.